Today we're talking about a new product for preventing infection and also how to use Botox for tooth grinding. There it is, new product for preventing infection. You probably don't think about how we clean your skin before we give you an injection, but it's actually super important, especially when you're doing something like dermal filler, which is basically giving you a semi-permanent implant into the skin. So a lot of patients come in and they've got a foot of makeup on, which they haven't taken off before they come in. So then I have to scrub their skin using normally a baby wipe, and then we clean it using either chlorhexidine or something called betadine, which are used in surgery to get rid of any bacteria that's on the surface of the skin. But the problem with those is, first of all, the chlorhexidine, people can be allergic to it, which is a big issue. Second of all, it's not really good to use on broken or open skin, which obviously you will have if you've got an injection in the face and you're bleeding a little bit from there. Betadine is slightly problematic because it's a bit sticky and it's brown, which is not a good look if you've got a bit left on your skin afterwards. It's like a bad fake tan. Looks very bad. So enter this new product here, which is called Clinicept. Now this is really interesting because there hasn't been much change in what we use for skin cleansing in many years. I'm talking like 50, 100 years. We've always been using either alcohol, betadine or chlorhexidine. But this bad boy is based on something called hypochlorous acid, which I know it doesn't sound particularly sexy or anything, but what it means is you're not going to be allergic to it. It will get rid of, kill the bacteria, etc., whatever's on your skin beforehand, and it can be used for on open skin as well. So if you've got a graze or a cut or something like that, it's actually perfectly safe to put that on, and it's clear, so you're not going to be left with this horrible, like, manky tan look afterwards. What happens when we get a patient in who's maybe a little bit nervous, maybe they haven't had any treatment done before, and they want a change, but they don't want to see a big change. They want something that people are going to ask them, have you just come back from your holidays, for example? And that's what we do. We just give them a very small amount of refinement. So the patient that you're going to be seeing today, we did some Botox for her in the forehead, the crow's feet, and we also used Botox to slightly slim her jaw muscles because she's a tooth grinder. And we used a very small amount of dermal filler just in the front part of the cheek because she's looking a bit flat there. And that's it. That's all we did, nothing more. But you can see she does look that little bit fresher and a bit softer after the treatment was completed. So let's talk a bit more about that. First of all, you can see here I'm using some Botox in the glabella, which is the line in between the eyebrows. And everybody thinks that by adding Botox there, what we're trying to do is to get rid of that line. But actually, what we're trying to do is make the person look softer and not as angry. We're taking away that angry, frowny look that sometimes people can get. It also has the effect of slightly raising up the brow by maybe a millimeter or two, which also helps somebody look a bit more fresh. What you're seeing here is the technique that I like to use in the forehead. I'm using really tiny microdoses in the forehead, so she's still preserving her movement, and you'll see that in the after video that we've got. So she can still raise up her forehead. She's still got the lines there. They're just not quite as bad as they used to be. So in her before shot, she had some forehead lines at rest on the left of the picture. And you can see that in the after, those lines are no longer there. Now we're just going to inject the smile lines. This is also called the crow's feet. It's quite a normal procedure, but it can make a subtle difference. This bit here is where it gets a bit more interesting. So you saw on her before pictures that she had quite a wide face, which is a masculinizing feature. Now, some women can get away with that. For example, Angelina Jolie, she's got a very, very wide face. She's got strong masseters and it looks great on her. She's very beautiful. This patient, she also has the same facial structure as Angelina Jolie does, but they're just a touch too wide. So what we're going to do is to slim them down a little bit just using Botox. She's still going to have them afterwards, and you can see in the after picture she still has them, but they just look a little bit softer and a little bit more feminine. This is a great treatment for people who are tooth grinders. So often with a tooth grinder, you'll see that across the biting surfaces of the teeth, they've started to wear that away and the teeth become shorter and shorter and shorter. Using Botox in this particular muscle can help to prevent that from happening. If you're somebody who clenches your teeth and you have a lot of tension like this, in your jaw, normally this muscle here, the temporalis muscle, is the one which is responsible for that, and we can also Botox that one too. Let me just show you that on a model. That bit there, that's the masseter muscle, which is making the jaw appear wider than it should really be. And then on the other side here, we've got the temporalis muscle, which is the one that I was just mentioning in relation to people who are clenching. So this is clenching, this is grinding. Interestingly, you tend to get a longer clinical effect when you are using Botox in the masseter muscle as opposed to in the frown lines or in the forehead lines. So you'll normally get about 6 months maybe out of a masseter treatment, whereas you'll normally only get about 3 to 4 months in the upper third of the face. Obviously that's very patient dependent, but it's just as a rough guideline. Because this patient is a little bit flat over the front part of her cheek and she's got these really deep grooves going up into the tear trough region just here. What we need to do is to bring forward her cheek first before we can even start to think about looking at the tear trough. So we're using a cannula with the TSL pen here, and you can see I'm actually going quite close to where the tear trough begins, but I'm not entering the tear trough. I'm just depositing this filler in the deep fat compartment here to give her a bit more volume. But you can see in the after pictures that it does actually make the tear trough look a little bit better as well without treating the tear trough. Let's just have a quick look at this half and half. So you can see here I've treated the anatomical right, which is on the left side of the screen, so we can compare the two sides. You see that she's got a little bit less hollowness on the right hand side as opposed to the left. Often people think they look tired if they've got flatness in the front part of the cheek or a deep tear trough, and adding volume here can really help to relieve that tiredness factor, and of course makes people feel better about the way they look. So let's take a look at these before and afters. You can see in the before, she's just got these really faint horizontal forehead lines just on one side, and in the afters we've smoothed those out. You can't really see them. She's not tensing in the before pictures. She's just got this resting tension in the muscles. It's not something she's doing on purpose. You can also see the angle of the jaw is just slightly different, slightly softer in the afters. Let's just have a look at that from the side as well. You see the jawline looks a lot more feminine there. And lastly, let's just have a look at this depression underneath the eye here, where we've just added the volume right there. You see it doesn't look quite as deep in the tear trough region in the afters, and you can probably see that a little bit better in this oblique view. This treatment is great for patients who are maybe slightly apprehensive about having treatment done, because you can see she can very easily go out for dinner or to a social occasion immediately after the treatment, and in the before and afters you can see there isn't a huge amount of change. It's just a very, very subtle refinement of the features she already has. Okay, TLCers, that's all we've got time for this week. Join me next week for some festive fun, and in the meantime, don't forget to like, comment and subscribe.